Hello everybody, this is Pejman Pir Moradi, doctor in pharmacy. This is my fifth session regarding our health system. This session is called This is a War. In this session I will explain to you why we have a war going on in our health system. This is a peculiar type of war. It's different than any other war that you have seen in your life or we have heard about it. This war has, just like any other war, has several elements. The elements of the declaration, the element of surprise, war codes, traps, forces that you're fighting the battle for each side, and you have casualties. Strategies to win the war, and of course the casualties that either side might have, or both sides, are the result of the war. I told you this war is peculiar that we have in our health system. Casualties are not from either side. Let me explain. The war is between the health insurance companies and from one side, and the other side of the war are healthcare providers like hospitals, physicians' offices, diagnostic centers like MRIs, laboratories, so on and so forth. Each side is trying to win the battle, and in this war you have, of course, casualties, you have element of surprise, you have traps in this war. The peculiarity of this war is the casualties are not from either side and traps are not from either side. The strategies to win the war is not against either side of the war, and all are meant and designed to win against the people caught in the crossfire in this war. So the insurance companies are trying to maximize the profit, and by minimizing the pay, and the healthcare providers like hospitals are trying to maximize the profit, the money that comes out of your pocket and the money that they get from insurance companies. In this war, again, I said in every war there's a declaration. There was no decency to declare the war. The element of surprises, you have billing surprises. So you look at your bill, you get surprised. You cannot make sense of it. It's complex. It's gibberish. The war codes that I explained, the indecipherable war codes that they are using each side to maximize the profit. Me and you are not supposed to understand it. Bystanders, we are the casualties of the war. And also the government is the casualties of the war. No casualties from either side. Me and you and the government are losing the battle. Financially and emotionally, physically, we are under stress all the time in this system. And government is going on daily basis under more stress, financial situation, trying to come up with the money to take care of the health system. Because me and you are going to file for bankruptcy eventually because we cannot pay our medical bills, and government has to put us on Medicaid, and like a vicious cycle, more stress on the government, more stress on me and you, and these two sides of the war that are fighting the battle with their troops are winning. Both sides are winners because they are maximizing the profit that they are gaining on yearly basis, and they are gaining more and more and more. The element of surprise, the traps that we have in the system, in network, out network, a lot of confusions they create for you and me. These are all intentional, complex situation. You cannot make understand your medical bill because there are war codes, gibberish codes, indecipherable codes that nobody can understand, and they come up with these codes, thousands of them, ICD-9 codes, DRG codes, CPT codes that they use in physician offices and hospitals, and each side understands them. They have forces to win the battle for them. Billing clerks, insurance adjusters, they all understand these codes. There are courses for them. They get bachelors of science in this field of coding, billing system, and they get master's degrees in this system. It's a very complicated system. It's intentionally created that way, so me and you won't understand, we won't be able to object it. And these are war codes, gibberish codes that they're using. The traps that they're using, me and you are not supposed to understand what type of procedure we are getting, what type of service we are getting, what will be the cost of the service. Eventually everything is a cloudy, murky situation for me and you, because it's a war. Again, a peculiar war, no casualties from either side. And you have heard about the example, one example of the waste in this system, in this war, this crazy war, which is very sad, is billing clerks, the forces that they're using to maximize the profit. The strategy of the war is to use the best billing codes to beef the profit, to beef up the profit. And billing clerks are specialized to do that. This is the strategy of the war. And there is a hospital in New York, just give you an example of how crazy is the situation. With 900-bed hospital, they had 1,300 billing clerks. 900-bed hospitals, 1,300 billing clerks to come up with the best codes of the war to win the battle, not against the other side, against me and you in the crossfire. The last thing that I have today to tell you about this broken system, broken health system, that again I hesitate to call it a health care because intentionally and systematically is chipping away your happiness, productivity, dignity, and very health on daily basis, is a statement from a writer, researcher, and a health care advocate. Her name is Kat Lahr, and she says, and I quote, "One of the biggest issues we have in the U.S. healthcare system is not having enough money for a health system, but it is how that money is spent. We are not out of cash. We are not out of money. Government doesn't run out of cash because they cannot afford to pay for the system. The system is wrong. It's a money-eating, money-wasting machine, and it's a war that is trying to maximize the profit. Both sides are making more profit. By the way, hospitals are making more profit than health insurances these days. They are second after drug companies, and the insurance companies are the third one. This system has to change. We are going to change this system. Medicare for all, universal health care, national health care, whatever you call it, single payer system. And again, don't get freaked out. You're going to have the private sector next to it as a parallel system for people who want to spend more money to get better treatment in the system. Treatment has to be the same. It has to be a fair system. But if they want more service at the cost of their pocket, the insurance, the private sector would be still available. But this is the best way to go because we are wasting so much. It's a crazy system. It's a vicious cycle, and it has to change. And we are going to change it. Nothing is impossible if you put your heart and mind into it. And this broken system has to go away. We need to change the foundation of this system. For-profit system cannot last in healthcare. It's not ethical, it's not transparent, it's not productive, it's not healing, and it's not consistent in quality. Thank you so much for tuning in, and please share this video with your friends and with your family, and I'm looking forward to see you in the next session. Thank you so much. You have a good day. Bye.